Hello everyone and welcome to the Taster session for Health and Social Care. So we're just going to talk a little bit about the course to begin with. Our exam board is OCR and the full title of the course is the Level 3 Cambridge Technical Extended Certificate in Health and Social Care. Now while we're not an A-level, we are the equivalent of an A-level and we track the same UCAS points as the equivalent UCAS grades. Over the 2 years, you're going to study 6 units, 3 of which are examined units and the other 3 being non-examined assessment, also known as coursework. So the 3 exam units are Equality, Diversity and Rights, Health, Safety and Security, and Anatomy and Physiology. We take these exams throughout the 2 years and we find this really benefits our students because it means in the final summer, students already have completed all of their health and social care exams, and this means that you are free to concentrate on your other A-level subjects. Now we also have 3 non-examined assessments, so those units are Physiological Disorders, Nutrition for Health and Building Positive Relationships. There are a multitude of tasks that you can complete as part of your coursework, and we're going to look at one later today. Now, building positive relationships, that's the unit that we're going to talk about in our taster session. Now, in building positive relationships, we look at a variety of different ways that we can help maintain those positive relationships between professionals and service users. In this unit, we'll look at types of relationships and relationship context. We'll look at communication factors, cultural factors, environmental factors, spiritual factors, physical factors, strategies to ensure a person-centred approach, and by that we mean to make sure that the service user is at the heart of everything that we do. We'll look at communication skills in practice, and we'll look at reflective practice, so reflecting back on what we could do better next time. In our coursework units, we focus on completing a task based on a set of criteria. Previous tasks include posters, information booklets, and the creation of case studies and reports. Now this is an example of a coursework task that the current Year 13s are completing for this unit. So their task is to produce an information booklet on the factors that can influence the building of positive relationships in health, social care and childcare environments that could be handed to people new to working in these settings. So we're going to build on that assignment brief and we're going to look at communication factors. So in communication, we can look at non-verbal communication, that's communication without the use of spoken language, and we can also look at verbal communication, communication using the spoken language. Another type of communication is written, and we'll look at that later in the PowerPoint. Now the first thing that I would like you to do is pause this PowerPoint and make me 2 lists. What makes up non-verbal communication? Write down all the things that you can think of that you do to display non-verbal communication. Your second list should be what makes up verbal communication. What influences the way that we speak and the words that we use? Pause now. We're going to start by looking at non-verbal communication, and 93% of the information that we give and receive is non-verbal. What I'd like you to do on the next slides is guess the emotion of the person that's in front of you. So, what do we think that this person is feeling right now? And if you said happy, you would be correct. So we can see that he's got a big smile on his face, he's giving us a thumbs up, so these gestures and his facial expression tells us that he is happy. What do we think that this person is conveying? If you said bored or unimpressed, you'd certainly be correct. We can see that she's got her arms crossed, that's showing quite defensive, negative body language, and her facial expression as well says that she's not particularly happy or engaged with something. What do we think that this person is trying to tell us? Yes, that emotion is scared. So he's got his hands up in a state of shock, mouth open, eyebrows raised, eyes wide, telling us that he is scared. What do we think that this person is feeling? Now there's a couple of things that you might have said. He could be worried or he could be concentrating. We can see that he's staring at a computer screen. He could be concentrating really hard or he could be worried. He's got his hands in front of his mouth, and also a sign of worry. Now what is this person feeling? She is upset. So she's looking down at the floor, she's got her head in her hands. We can look at the facial expression and see as well that she's quite upset. And the last one, what is this person feeling? So he is confused. He's got his hand up to his head like, what can I remember? He's got a quite furrowed brow. We can see from his facial expression that he's confused, or he might have forgotten something. So as well as the forms of non-verbal communication I've just talked about in the previous slides, make sure that you've got the rest of these down on your list. So we've got hand gestures. Now when people talk, they tend to move their hands. This is also cultural, and you will find it in some cultures more than others. We've got smell. So if somebody tends to smell nice, you'll want to be closer to them. If somebody doesn't smell so nice, you want to be further away, and that might impact the communication. Sometimes when we're nervous, we can tend to blink more. So if somebody is blinking, it can indicate to us that they are nervous in that situation, and we might want to employ some positive techniques to bring that communication back. We've got a variety of facial expressions as shown by the previous slides to show what type of emotion people are feeling. We've also got eye contact on that list. Now, when we're more comfortable with people, we tend to maintain more eye contact. So having that eye contact with people can mean that you are listening to them, that you're trusting them, and that's a really important positive aspect of communication. We've got posture on there. If you've got a particularly bad posture, you're slumped over, you're sat on a chair, that doesn't indicate that you're listening to somebody or you're engaged in what they're saying, then that can have a negative impact on that communication. So sitting up, leaning forward and positioning yourself to actively listen to them is a very positive step. Now positioning is the last point on this slide, and positioning has actually changed due to COVID. A lot of us have to maintain that 2-metre social distancing now, and that can really impact on our communication. So not only because some people cannot hear us anymore, but some people need that positioning of being closer to feel that human contact. So positioning certainly can influence our communication. Non-verbal communication matters as a carer because certain body language and gestures need to be avoided in order not to give people the wrong idea. Inappropriate, accidental or improper gestures in non-verbal communication can cause a negative work environment for all parties involved and can cause a lack of trust, resulting in a breakdown in the communication process. Now we see here an example of good communication and bad communication. In this example of good communication, the caregiver has brought himself down to the same level as the service user, opening up that equal communication, making that other person on the same level as him. Now in this bad communication example, it says our body language says a lot about our interest and our engagement in the communication we're having. We can see here that he's looking at that distraction, like his mobile phone in his pocket. He's not paying attention to the service user. He might not even be listening to what he's saying because he's distracted. Here we have a list of positive body language and negative body language, and we're just going to go through both now. So we've got smiling and laughing, showing that you're enjoying the conversation. If we slow down and breathe regularly, it shows that you're giving that other person time for the conversation and you're not rushing to be anywhere. Using your body with purpose and holding objects by your sides means that you're not physically putting a barrier between that clear communication. You might show your interest through that smiling and laughing, that nodding and making eye contact. Now, just to note, there are some things on these lists that have got an asterisk next to them, a little star, and that notes that these physical signs might vary depending on culture, which we are going to look at later in the PowerPoint. Leaning in closer, again, might be particularly difficult at the moment in order to maintain that social distancing, but generally when we lean in closer, when we position our body a little bit closer to the person that we're communicating with, it shows that we're interested in and engaged. And we also might mirror their body language too. Now, aspects of negative body language that we don't want to display because these suggest that we're not engaged in the conversation, we don't want to carry on with this, are things like clenched fists, crossed arms, dropping your shoulders. If you're fidgeting with objects, it's showing that you're not engaged and you don't want to be part of that conversation. Having your hands behind your head or your hands on your hips. Having your head down, your head resting on your hand, or looking at your watch or your phone. You might be massaging your temples, avoiding eye contact, shaking or tapping your legs. You might have shifty eyes looking at somewhere else in the room. Another thing with proximity is standing too close to people. If we do that, sometimes it can make people uncomfortable. Again, if we stand too far away, it means that we don't have that clear communication because others might not be able to hear us. Stroking our chin, that extends to playing with our hair or feeling our ears as well. Wiping your hands on clothes or blinking really fastly might indicate that you're nervous and you don't want to take part in this communication. Now, personal space and proximity is the physical space that you maintain between yourself and others when communicating. This is cultural also, so you have to be aware of your own and others' personal space. So these are the spheres of personal space and proximity. So the first sphere that we can see around that person in the middle is an intimate sphere. Now, this is up to 30 centimetres away from you, and that's reserved for close friends and family, people that you trust. If somebody that you didn't know came into your intimate circle, then you would start to feel quite uncomfortable. The next distance away, or proximity, we've got is personal, and that's between 30 centimetres and 1.5 metres away from you. Now, that's reserved for friends and informal conversation. Our social sphere is between 1.5 metres and 3.5 metres away from us, and that's an area for formal conversation and business transactions. So that might be between teacher and student. Then we've got the very last one that is public, and that's beyond 3.5 metres. That's the people that you don't know, that you see on the street. You'd start to feel a bit more uncomfortable if they came any closer to you than 3.5 metres. So we have to remember this when we are communicating with people, how comfortable they will feel if we get closer to them, or do they need us to get closer to them? Now, as I said earlier, different non-verbal gestures mean different things for different cultures. So if we look at a few here, we can see that in America, the goodbye wave can be interpreted as a signal for no in many parts of Europe and Latin America. The Italian goodbye wave can be interpreted by Americans as come here, and the American come here gesture can be seen as an insult in most Asian countries. In Malaysia, it's taboo to point with your index finger, but you can point with your thumb. And thumbs up is used in many cultures, none more so than Brazil. However, it's a rude sexual signal in some Islamic countries, Sardinia and Greece, and can signify the number 1 in France. So we can see it's really important to understand who you are communicating with, so you don't display anything negative in that communication. Now, sitting cross-legged is really common in North America and European countries. We certainly do it a lot here, but it's viewed as disrespectful to show the sole of your shoe to another person in Asia and the Middle East. In many cultures, they use their arms freely, as in Italy, so we're talking about hand gestures and the use of arms. where they often wave their arms around when talking, or the US, but Northern Europeans find it hard to tolerate gesturing with their arms. We associate it with insincerity and over-dramatisation. In Japan, gesturing with broad arm movements is considered impolite. Now, nodding your head generally means agreement or approval, and certainly here we would say that if we nodded our head in conversation, it showed that we were engaged and we were in agreement. But Bulgarians and Greeks, for example, are known for their unusual manner of saying yes and no. So they nod up and down, and that signifies a negative. In Portugal, the Portuguese tug their earlobes to indicate tasty food, but in Italy this gesture has sexual connotations, and in Spain it means somebody isn't paying for their drinks. In terms of eye contact, good eye contact is expected in the West. Strong eye contact is most notable in Spain, Greece and Arab countries, but Finns and the Japanese are embarrassed by another's stare and seek eye contact only at the beginning of a conversation. Now we're going to look at what makes a good verbal communicator. I'd like you to look back at the list of what verbal communication is made up of from the very first task, and I'd like you to look at what way could a person use those that you have on your list to have good communication. In what way might they use them to convey bad communication? Pause the PowerPoint now and write down a few ideas. The first aspect of non-verbal communication we're going to talk about is clarity, and this is how you speak so people understand what you're saying. Now, what can affect the clarity of your speech? We've got mumbling, talking too quickly, talking with your hands over your mouth, jargon or slang. Now, jargon is specific technical language. So an example of that in health and social care might be medical jargon, so medical terminology that the average Joe might not understand. We also have slang words. We have regional dialects. Now, a dialect is specific to the region, and an example of that would be bread cake. Now, all across the UK, people have different words for the word bread cake. Some people call it barm cake, bread roll, finger roll. That's an example of a regional dialect. It's a specific terminology related to an area, a geographical area. So how can you ensure that you have clarity in your voice? Well, you can speak clearly, make sure that you are enunciating your words. Don't run words together. So take your time and have that reasonable speed, especially when people do have hearing difficulties. And speak with confidence. We need to be able to use words that the person you're talking to will understand. So in specific relation to jargon or slang or regional dialect, it's really important for that clear communication that we are using words that our service user will understand and will know. And if we're not, then we need to be explaining them. Now the next aspect is language, and this is the words that we use in verbal communication. So what language difficulties can we face? Now, as mentioned on the previous slides, it's using words that people don't understand, like jargon and slang. An example of that jargon is that medical terminology, or it could be educational terminology. So these are two types of jargon that can be used in our health, social care and early years settings. We've got slang. Accents might pose a particular problem. If somebody has a particularly strong accent, it might be difficult to understand the language that they are using. There could be a problem with regional terms from your dialect. Again, we discussed this on the previous slide. One party could be using discriminatory language such as stereotyping, and this should never be tolerated in a conversation. We also need to make sure that our language is age appropriate. In health and social care, we're dealing with a variety of ages, right through from early years to very old age, and we need to make sure that the language that we're using is appropriate to the age range and also the service user's previous knowledge. Now, something else in health and social care that can pose a language difficulty is if we are speaking different languages. So if you're professional and your service user does have different languages, that might mean that we need to get an interpreter involved. So we can overcome this barrier, but it is another thing that we do have to overcome. Pace. Pace is how fast we speak. A pace of 100 to 120 words per minute represents the ideal pace for explaining information, and the pace of speech might be a way of conveying emotion. So a faster pace might indicate excitement, anxiety, agitation, nervousness, anger, or the person might seek to dominate the listener. Think about a time when you've been particularly nervous, say giving a presentation. You might have rushed through that presentation because you were nervous. A slow pace can indicate sadness or depression, although it also could indicate tiredness or boredom. Slow, emphasized speech might indicate dominance or hostility, and slow speech can also indicate an attraction between an individual and the listener. Empathy. Now this is having an understanding of the other person. And Gerald Egan says that this is the ability to enter into and understand the world of another person and communicate this understanding to him or her. It's a deep emotional and intellectual understanding of another, and we can't hope to communicate if we don't care about the other person. Empathising with a person strengthens the relationship. It also shows trust. So it's important here that we know the difference between empathy and sympathy. In empathy, we're putting ourselves in that other person's shoes, but sympathy, we're merely feeling sorry for the situation that person's in. Another really important aspect to communication is active listening. Now, the table here shows you the difference between just hearing and listening. Now, hearing is a passive process. It implies perceiving sound. Anyone can do it, and it's an effortless activity. So you will find yourself on your mobile phone on a night time, looking at social media, perhaps with the TV on in the background, and you are merely hearing what that TV is saying. You're not really engaging with it, and it's that passive process. Now, if we go on to listening, listening actually involves understanding information. It's an active process, and it requires conscious effort, concentration, and interest on behalf of both parties. Now here we have some active listening behaviours. These are things that we would hope to put in place to show people that we are listening and we're not just hearing. If we start from the top, we will go clockwise all the way around. So it's really important not to overtalk. We need to give other people a chance in the conversation to have their say. We need to be empathetic and put ourselves in their shoes, making eye contact and exhibiting affirmative head nods and appropriate facial expressions like smiles. Asking questions shows the other person that you're engaged in the topic. Avoiding distractive actions or gestures. It's a good idea to paraphrase, and what we mean by that is taking what that other person has said and rephrasing it to show that other person that we understand what they've just said. And it's really important that we avoid interrupting the speaker. Now we've looked at non-verbal communication and we've looked at verbal communication. Another really important part of communication is written. And this is widely used and a very important method of communication in care settings. Structured forms help ensure that staff ask important questions and record the correct information. So whether that's in healthcare, in social care, or in early years settings. Written information is a permanent record, therefore it must be accurate at the time of writing. It's important to avoid slang and jargon and use non-discriminatory language. It must be legible, so that means it must be easy to read. It's got to be factual, containing only relevant information and not the care worker's own interpretation or feelings. We need to keep it professional and very factual. And it also needs to be concise and to the point. We don't need to waffle on about anything. We need to keep it brief and keep it to the sections that are required. Now, an example of written communication in a health and social care setting would be a care plan. Now, care plans are written by individuals with the help of professionals. It should be person-centred, which means it's always focused on the individual, and it should express their wants, needs and desires. If a plan is not followed, care will be affected, which could lead to severe consequences. You might want to pause the PowerPoint now so that you can read through this example of a care plan. Other examples of written communication include newsletters that's commonly sent out for care homes and nurseries. We've got notice boards that could be in reception areas of nurseries, care homes again. You might have outpatient units. And down at the bottom we can see an example of confidential patient notes. So what can happen if communication is inappropriate? Well, if communication is inappropriate, it can lead to barriers between professionals and service users. Some of these could even affect a service user for years to come and can stop them accessing future services. We need to make sure that we're choosing an appropriate method of communication in the first place, and then when we do that, we're displaying positive verbal and non-verbal methods so that we ensure a positive, trusting and open relationship is built.
Hi, I'm Hannah. I talked with you, I know, the other day, but I just wanted to touch base today, about your stuff, your situation. So I read your chart, and I know we talked last time. Are you still feeling depressed? Yeah, a depression. So okay. Depression. And I know you're feeling depressed now, but I felt depressed before, and it will pass. Like, you'll get over it. It's not that big of a deal. And so this depression, why are you feeling depressed? Oh, wait, sorry, I had another note. Something else I wanted to ask you before. No, why, or is that depression what brought you in here?
Well, I OD'd earlier because I was
Depressed?
sad.
Yeah. Okay, so that overdose we'll have to talk about. So then why are you feeling depressed?
Well, I was abused earlier. Just don't.
I mean, your life doesn't, I looked in your chart and your life doesn't seem all that bad. So this depression, I think you can get over it. Yeah. Let me look at my notes here. I know we saw some stuff. Oh, hey. Yeah, can I talk to you later? I'm gonna finish talking to her. Okay. Sorry, I lost my train of thought. Let me look at my notes here. You got the abuse, the overdose. So can we talk about these thoughts? Oh, that area. Do you wanna, are you still having those thoughts?
No.
No? Okay, then. Great. No thoughts? Because I know, if you're having them, it's kind of like, why? I don't understand why people think of, killing themselves. It's really very weak of them to do. Personally. But anywho's, oh, hold on a second. Hello? No, I'm at work right now. Yeah, at Belmont. Yeah. I'm going to talk with this patient here. Yeah, and I'll call you back. Okay. Okay. I'm sorry. Yeah. Anywho, so let me look at my notes. But so you, those thoughts we were saying, what were you saying about those? Did you have them? I forget.
Well, No.
No. Okay. Okay, that's great. I'm glad. So are you feeling better then?
I guess a little.
Yeah. So what do you think has worked in your therapy?
I like talking to the therapist.
One-on-one? Okay. Well, do you want me to see if your doctor's available? I can
Yeah.
totally arrange that. Okay, I'm gonna go check that then right now.
Okay.
Yeah. Okay. Okay, that's great. I'm glad. So are you feeling better then?
I guess a little.
Yeah. So what do you think has worked in your therapy?
I like talking to the therapist.
One-on-one? Okay. Well, do you want me to see if your doctor's available? I can totally arrange that. Okay, I'm gonna go check that then right now.
Okay.
So thank you for joining me on this taster session today. If you do have any further questions and need any information about the course, please email me. The email is on screen now. Thank you, and I look forward to seeing you in September.